Hey, Steve, thanks for taking a few minutes to talk to us today.
Thanks, Justin. Nice to be here.
Yeah, absolutely. Our organizations, the American Heart Association and the Mayo Clinic, have had you and I co-chairing the Cardiovascular Health Alliance for a few years now. And I was wondering if you could share with our viewers, what is that group and why is it important?
Well, it's I think, a very important group. I agree. The mission really is to reduce cardiovascular disease in the state of Minnesota and the citizens of the state of Minnesota, which is, of course, wonderful. I think the job has been good, but it never stops. And so our vision is really that everybody in Minnesota should be stroke-free, heart disease-free, which is a big goal, believe me.
Nice, very cool. One of the primary responsibilities of the Cardiovascular Health Alliance is to advise on the creation of the state plan for heart disease and stroke, which we redo every 10 years, and we're in the midst of redoing again now. What is that plan used for?
Well, it's kind of a roadmap for the next 10 years, how we're going to focus, what we're going to put our efforts towards. We want to help the most people possible with our efforts. It's very strategic. We divided the groups up into three. Now there's prevention group, there's the acute management group, and there's the disease management, the chronic disease management, the hypertension, the diabetes, things like that. So we'll try to have a roadmap, say where are we going to go, how are we going to get there, what are we trying to do. So everybody's input is very important. The professionals, the patients, the communities, the ethnic groups, and the ambulance drivers, nurses, doctors, et cetera, social workers. So everybody has some input because we all see these problems from different angles, and our answers and our ways to solve it help each other work together.
Yeah, that collaboration really ends up creating a vision for Minnesota that is all inclusive. So I agree. I think that's a great explanation of the state plan. This year, we're doing the state plan a little different. For the first time ever, we're combining the state plan for cardiovascular disease and stroke with the state plan for diabetes. Why does that make sense?
Well, the only part that didn't make sense is why did it take so long to do it, to combine it? Because if you look at heart disease and diabetes, the risk factors for those two diseases there's some very similar components, like being overweight, like not exercising enough. Both patients or both groups of people develop heart disease and diabetes. Secondly, not only are the risk factors the same, but many of the diseases that these folks get are the same. So a diabetic, what do they have? They have hypertension. They have elevated cholesterol. What about people with heart disease? They also have hypertension and elevated cholesterol. And then finally, if you look at the outcomes, what happens to diabetics? 85% of diabetics have cardiovascular disease and die from it. And obviously the patients with heart disease are in the same boat. So there's so much overlap that it really makes sense to work together.
It really did. And it's amazing how many of those tactics and suggestions really overlap from previous state plans. So your joke about why this took so long really is fitting because we should have done this a while ago. I agree.
Yeah.
I also wanted to ask you about the Mayo Clinic is such a leader in the COVID response, and we've had such a long relationship between the Heart Association and the Mayo Clinic. This year, the Mayo Clinic received one of AHA's rapid response grants to study the effects of COVID on patients who already have heart disease, just sort of showing that partnership and the track record of the Mayo Clinic and being out front with research. What are other latest news regarding COVID from the Mayo Clinic?
Well, it's really amazing that if you have heart disease and then you get COVID, that's one of the highest risk COVID patients. Your risk for complications, for being intubated, being on a respirator, for dying, if you have heart disease, are very high. Secondly, we're finding that the heart disease patients, surprisingly, are really some of the least, have the least healthy COVID behaviors, meaning things like wearing a mask, social distancing, washing your hands. And while they're at the highest risk, they have some of the least healthy behaviors. So the COVID, the complications are much higher with heart disease, and we're not doing quite as good a job as we should to prevent it. And then finally, we've known that for years that the flu shot can be very helpful. So we're trying to spread the word that flu shots can prevent flu, which is a big deal. And the risk factors for flu and the risk factors for COVID, having complications from those diseases, are very similar also.
Right.
So we're trying to get the most bang for our buck here.
That's really great. Thanks for being such a great partner and being such a great example of Minnesota ingenuity going forward, in the face of a national crisis like this. And despite all of our efforts from your organization and our organization, cardiovascular disease still remains the #1 killer of all women. So claiming more lives than all forms of cancer combined. And so for your area down in Rochester, we have a first of a kind event. We're going to have our first Go Red for Women virtual event in Rochester on September 17th at 6:30. So anybody that wants to find out more or participate, you can go to heart.org/Minnesota MN Go Red. We'll put the link on the screen there for you as well. But I wanted to say thanks because the Mayo Clinic is a leading presenting sponsor of that event. So continuing our work together and our partnership for a healthier Minnesota and a healthier America. So thanks again, Steve.
Thank you, Justin. Great talking to you.
Have a great day. We'll talk to you soon.
Okay.